It is 2025, medical practice owners, and you're looking for tips on how to be successful. Guess what? You come to the right place because we've unpacked tons of great information over the last year, 25 different tips to kind of guide you on how to better connect with your patients, how to understand health insurance, how to understand this new normal of value-based care and technology. AI is rampant. How's that going to change how you practice medicine? So check out these tips to be successful this year. This is a big organization that's been set up to kind of help manage the process of ensuring that certain things are met so that patients get the best quality care. Payers adhere to it. A lot of large organizations adhere to it. And also, if you don't know, if you're a doctor or medical provider, your incentive bonuses are tied to that as well. If you can increase your measurements, your quality measurements, that has a huge impact. We're seeing incentive payments helping you increase anywhere from 13 to 17% in incentive payments coming back to your organization. So something as simple as 1-star increase for any one of these measurements can really help move the needle for you before the end of the year. So it's imperative that you try to close these gaps before the end of the year. Another thing you can kind of look as, are there any of those surveys that you can do, right? One of the big one is the social determinants of health. Making sure you're kind of surveying patients around their food insecurities, understanding their transportation needs, understanding if they have caregivers that can help them. So that's a simple survey. If that hasn't been done yet, that can be done to kind of close that gap before the end of the year. And then finally, we'll make sure a partner that's flexible. They understand the needs of patients at home. So sometimes the patients can be called at certain times. The daytime is better versus the night times. Sometimes it's better to have the patient call in and making sure you communicate with them. But having a partner that understands that can be flexible so that you can meet that gap closure is really going to be important. One of the things that we're seeing tremendously is what healthcare organizations are looking at as they look to grow for the future. One of the key things that's happening is patient care being delivered at home or remotely is becoming table stakes now. After the pandemic, we've seen tremendous interest in patients receiving care at home for things like wellness visits, outreach for care of chronic conditions, helping select new doctors and support for that. Caregiver support. There are tons of different opportunities where we're seeing healthcare organizations look for ways that they can deliver it at scale. Outsourced healthcare services is going to be more and more important as healthcare organizations are constrained by their current budgets to grow where they see possible. That's why we're talking about a new delivery model. This delivery model is called Remote Care as a Service, or RCAS. It's a new term, but it's something that's been around for ages. Telehealth is a component of that piece, right? But Remote Care as a Service is definitely more comprehensive. It's a more delivery model that combines technology, processes, and financial acumen in order to deliver care at scale for patients that want it at home. So how do you kind of break it down when you think about those different areas in delivering healthcare to the patients that want it most? One of the ways we think about it is, number one, you have to think about the technology. The advent of telehealth spearheaded this, but that was only because of the ubiquity of smartphones and technology that can deliver person-to-person communication anywhere in the world. I remember talking to clients about how we're not just constrained to a geographic area anymore. We know what's happening anywhere across the world. And this is important when it comes to remote care. Having these cellular devices communicate wherever a patient lives is important, not just from a communication, but also to grab vital patient physiological conditions, such as blood pressure, weight, glucose readings. All these type of physiological readings can give insight into how the patient is helping. More importantly, we're seeing the advent of delivery of drugs and other type of services to patients at home. Tests are now being delivered at home. So patients can do a lot of the things that they used to have to go to the hospital or to the doctor to do. It can be delivered at home. And we're going to see more and more of that. Technology enabled by cellular enabled technology devices like blood pressure cuffs that have cellular chips in them that can deliver information wherever the patient is at. We've had cases where patients have traveled across the country and still were able to take their blood pressure readings where the doctor can see them remotely. So having cellular technology is important, and devices. But then how do you deliver that at scale? If your organization, having the technology is one thing, but being able to deliver it across the organization is going to be huge and very important. Technology can help with that as well. With the advent of artificial intelligence, the ability to do two things, right? One of the things that we see artificial intelligence help in is to be able to communicate to patients cultural relevant information. For instance, artificial intelligence is really good at scale. So that means it can personalize specific conversations to patients that need it most. We've seen cases where we'll be able to translate text messaging or even change messaging to make sure it fits a certain literacy level. Typically, we try to reach out to patients at the 5th grade level in any language so that a patient can understand exactly what they need to do at home remotely. Workflows are so very vital for healthcare organizations, right? And the ability to kind of deliver this at scale is difficult, right? Because workflows now work well when the patient arrives into office where it's an environment that is controlled. You have your front desk office, you have your medical assistants or LPNs that come in and treat the patient in the clinic setting prior to the doctor seeing them. So everything that's done that needs to be done prior, taking the blood pressure, taking the weight, and then a general sense of that. So when the doctor comes in, the patient's teed up for the doctor to deliver the care. And then there's the back office staff to kind of help with the billing. Well, imagine this is flipped on its head where now the environment has to conform to the patient. The patient may be sitting in their car talking to a psychologist. They may be on the road trying to figure out their medication and getting that delivered before they go on vacation. So the environment has to evolve and change. And that's where remote care as a service can deliver that. Having a team that you can outsource a lot of that to can kind of understand how to make those workflows match better is really key. Finally, you want to look at that financial understanding of how to deliver remote care as a service. Look, it's no secret that a lot of stuff you could potentially do in staff, in office. But we've seen time and time again how healthcare organizations, especially when you look at clinical settings, it's difficult to deliver something like this in the office because you're optimized for a fee-for-service model. Patients come in, they go out. Really works really well when that model was the dominant model. But now with the advent of technology, like we talked about, and the ability to deliver services remotely, now you have to create new models that make sense. For instance, we've seen cases where if you're delivering these services in-house, you're looking at least profitability loss of about 20 to 35%. How does that calculate it? Well, when you look at buying the devices, handling mobile services, handle logistics of that, all the upfront fees for the technology to deliver and operationalize it so it's integrated to your EMR more effectively, the training that goes into understanding how to deliver that type of technology to your staff and ongoing updates, that's just the upfront piece, right? Now, the ongoing piece, if you're trying to have staff members in-house deliver remote care, it's almost like you have a bifurcated model. You're going to have 2 staff team members to kind of deliver these services. One is delivering your core services that you deliver in-house with your healthcare organization, and the other team that's just focused on patients that hardly ever come into the office, or they come maybe once a year. So it's 2 different organizations. And so now this remote team, they may have to work different hours. They may have to have a manager that manages them differently. There's productivity models that you can follow, understanding how many outreaches have happened with that patient population, understanding how often the patient is being communicated with, meeting certain metrics in minutes and hours that you spend with the patient, and ultimately making sure the patient feels connected with constant communication and updates. That's a totally different model than a model where a patient is coming in consistently.
You mentioned the process of how doctors' incentives. Could you just elaborate as to what that incentive structure is for a doctor? So you say a third party is the one paying them and they're not necessarily always incentivized to give the patients the best care. Yeah, can you just explain that for someone who might not even know medicine that much?
Absolutely.
Curious.
Well, you're a finance guy, right? There's a thing called the agency problem, right? And so they're not aligned. So like if you have a financial planner and they're not incentivized to, how well they're performing your portfolio, if they're working with you, then guess what? They're not going to do as well because they're not aligned. So that's one area. So when you don't have people, there's not incentive alignment, then, people are at cross purposes. And so likewise, when it comes to doctors, what happens is they do the service and then they bill it with these called CPT codes, right? Any service they do, they have to put into their computer or to the EMR, the electronic medical record. And then basically a third party, typically Medicare, Medicaid, or like third party insurer like Aetna or United Healthcare, they're the ones who justify if this patient can get the service you already delivered and how much you're going to get paid for it. And so now the doctor's like, wait a minute, I saw Jack fix his arm. They paid me 20% less than they paid last time. What happened? Oh, well, Jack didn't qualify. You didn't call us for what they call prior authorization to determine if Jack could even get that procedure, or we just decide that Jack no longer qualifies. And so that's the frustrating part, that whole process of getting paid. And so when the doctors realize that services that they would have, done okay and still okay getting financially incentivized for, they realize that, I can't do that service anymore. So Jack, I can't fix your arm anymore, but if you need surgery, I'll do that because that's going to be higher value for them. It just may seem like you're getting pushed to more of the higher type of surgeries, or they may not see patients like you at all and is focused more on the patients who need the higher value type procedures and services, right?
It's also a good business opportunity for doctors, for them. Like you mentioned doctors on social media before, how there's some with 60,000 followers, but it's a way that they could, first off, they could connect with random people that could potentially be their patients, but also their patients who they've seen maybe, I have a dentist. I go to him once every 6 months. I don't think about my dentist after I'm in the office, but if my dentist is posting on social media, I see his face as a reminder, and it's there's more of a connection between the doctor and the patient. Absolutely. And it allows you to then reference, next time in the office, hey doc, I saw this video that you did, loved it, and you have a question about it. It almost I think there is a very valuable path for doctors in general to just take advantage of social media, because they could just connect with more people.
Yeah, let's just break that down. Like I said, I just did some great interviews with several doctors. One is a cardiologist. He's been in social media even before the pandemic. And the one thing he said was that it helped him as a cardiologist to kind of answer questions, because he kept getting the same questions over and over again.
Yeah.
So by, doing a social media presence and answering his questions, he was able to do his patients a lot better. Also, people see you more and you build trust, you be a fluencer. And so now there actually have been people who reached out to him and told him his help prevented them from worse fates with dealing with cardiovascular disease and at that level. And so he was able to help individuals that he's not getting reimbursed for, just giving his advice, tell them, if they need help, go directly see their local patient. But that trust level is hard to get. And I think we're seeing even with social media during the pandemic, a lot of misinformation, or even now with stuff going out. But if you can build that trust, especially with someone that knows what they're talking about, that has a degree, that does this for a living, I think that's way powerful. And so doctors should definitely go into more social media and stuff and do more of that and communicate the value that they bring. Not just for the views, but just to help people.
If you're struggling to start your remote care programs, I have some solutions for you. Let's talk about how you go from 0 to 1,000 patients in 90 days with remote care programs. Number one, you have to understand these programs in depth. You may be aware of programs like remote patient monitoring, chronic care management, remote therapeutic monitoring, but there's so many more that they just introduced. One's around helping patients navigate new cancer diagnosis, one to help train caregivers. There's even one to help understand what is going on with the patient from a pain standpoint. All these different new reimbursable opportunities are there for you to grab, but you need to do a deep dive in really understanding it. These are some things and nuances you need to be aware of as you get started down that path. So that's the first step. It's always about awareness, right? Before you begin any journey, it's best to have a map to understand exactly what the path is going forward. The second step is you need to have a workflow. What does that mean? That means understanding every step of the journey when it comes to your patients. One of the things that we walk a lot of our clients through is just making sure they understand everything from patient recruitment to patient acceptance to patient onboarding to patient delivery of devices if that's necessary, to delivering service to the patient, all the way to patient exit from the program. So these are the steps you have to understand clearly before you begin anything. For instance, if you're going to recruit, you need an efficient way to communicate with them. We have a standard operating procedure where we utilize scripting that allows us to communicate consistently to patients that we know will give us the best response. A lot of patients are unsure and don't see the necessity of it, but we've seen a lot of more acceptance, especially due to the fact that you as a medical professional realizes that this is something they need and can really help them. As we continue thinking about this workflow, you need to understand, okay, now how are you going to deliver this service? As practices struggle with hiring individuals for remote programs can be just as difficult. You need individuals who understand the necessity of having a clear and clean manner when they're on the phone. You need to ensure that the remote staff, and this could be whether nurses or medical assistants, need to understand the framework of how they're guiding a patient and building a connection via the phone. We do tools such as motivational interviewing, where we're guiding them toward a path to understand exactly what makes them feel good about this path forward. So we've seen practices that implement this are able to keep patients engaged 90% of the time throughout the month as you're delivering these programs. And how you're doing that? Because you form a bond, an extension, and guiding them in that path to success. The next step is guiding your team towards success. What does that mean? That means having a clear vision on what you're building here. We talk about this a lot, a patient first culture. So what does that mean? That means understanding succinctly what is guiding the patient and it's going to be best for the patient. For instance, yes, you could provide all these different services to the patient, but maybe the patient doesn't need 40, 60 minutes a month. Maybe they only need 20 minutes with a nurse calling them to check in on their chronic condition. Maybe understanding the benefits to the patient, but more importantly, understanding when maybe they don't need to be on these programs, right? Maybe they've improved so much that it may be time to take them off. Patient first culture ensures that's from the front desk to the back office. So the front desk, when they're coming into your physical location, making sure your front desk staff is friendly and kind and greeting them so that when you introduce them to these programs, they're more acceptable. On the back office, making sure it's clearly explained exactly what the billing requirements are for these type of programs, if they're receiving devices or if you're providing your remote nurse services. This is very key because if you have buy-in from your team, then you have structure. And then once that structure is together, then they understand what they're accountable for. Next, you want to make sure that you have the partners in place. You can't do it alone. As a physician, as a medical practice owner, a clinic owner, you're trying to do so many different things, right? The number one thing you should kind of focus on is what you do best. This is seriously the best way to improve is focus on your strengths. And by focus on your strengths, we've seen this time and time again, that allows for the best progress forward. Even we have partnered with organizations before to help us scale and grow and provide the best care. Think of providing more value to your patients. So what does partnering look like? You do it now. You have technology vendors that help you with the EMR. You have IT staff to help you with new solutions. You bring in consultants to help you with staffing issues. You have CPA to help you with your books. Likewise, having certified or individuals that understand these remote care programs to such a level is going to help you succeed even more and beyond what you can expect. And then last but not least, you want to have a way to continually improve the program, having monthly meetings. This is simple. Stephen Covey talked about is called sharpening the saw, making sure any process you put together is consistently improved upon so that it can get better and better all the time. These programs are changing all the time. Every year, the physician fee schedule comes out and there is a new code or new tweaks to the old codes. So you need to be aware of that and how you can change and adjust accordingly. Insurances are changing. Understand what insurance accept what. You may have different goals for the practice, right? And where you want to go. So understand how that adapts. Having these monthly, quarterly meetings to continually work through that process will help you scale these programs even faster. Good customer service. Your patients, for lack of a better term, are customers, right? They have a problem that you're trying to solve for them. And it really goes back to really delivering high level services to your patient populations, because ultimately it's about patient satisfaction. If you have a vision for that, make sure that vision is clear in your mind. Think of the best customer service experience that you've had and think about how you can incorporate that into your practice, right? And that gives you almost like a vision. It's hard to go somewhere if you can't see it first. So having a clear vision of exactly where you want to take this is really going to help you get to that next level, right? And so having a clear vision in your mind, what great customer service looks like, will help you have that vision for your practice. So once you kind of have that clear vision of exactly what does that look like for your medical practice, then you want to be able to communicate that vision. A simple vision could be like a mantra, right? Something simple as our patients get the best care that we're capable of giving, or the best care for the best patients. So you see how we worded that? The way you say it is you communicate it where the assumption is that you have the best patients, so they deserve the best care. So now that communicates to your team that, hey, we only serve best patients. And so we coming in knowing that our patients are the best. If you are running your business, whether it's a healthcare organization, medical billing company, medical practice, and you're looking at how can you grow, look to collaborate. Typically, the best way to do that is see someone who has a large audience and you have an offer. So for instance, you go on that person's podcast or their audience, whether it's podcast, a video, their event, they are able to promote their offer on your platform, then there could be some kind of exchange of services. For instance, you could get a percentage of everything that person sells on your platform. And that's a win-win in business world. Likewise, with healthcare companies, you have to be very strict about kickback laws, understanding how to avoid that. But if you have a way to partner with individuals who offer different services, and you can pair up together to offer a complete service to your customers, that is a win-win. Look to collaborate, partner, look for those individuals who are open to those kind of conversations and have multiple conversations and see what works best. When you look at collaborations, you have to make sure there's a cultural fit to make sure you both believe similar things. Also, making sure you don't have similar services so there's no cross purposes and everyone's aligned to what they want to do. And ultimately, you want to make sure you can enjoy time with that person forward thinking. One of the things that I saw David Shands talk about and what Myron Golden talked about in this conversation was just thinking about the next level, right? How are they going to take their business to the next level? They really obsess over not just their business, but the business of their clients, their customers, and going deep into understanding what do they need now. One of the things they kind of asked questions around was like thinking through what kind of offers you want to present to the marketplace. What kind of solution sets do you have for your clients or for your customers or for your patients that they can utilize as they're trying to navigate new realities? One of the things Myron mentioned was that you have to become a person that obsesses over your customers' problems. Likewise, if you're a doctor, it's very similar to you understanding the pain points of your patients. You have to diagnose the pain and understand where the pain's coming from. But more importantly, it's something that you have to live and breathe, thinking about all the ways that they're struggling and how you potentially could help them. And I think that's the thing as an entrepreneur. If you can show that you're obsessed with their problems and you think about more than your customer thinks about their own problem, then there's a great chance they believe that you can help them. One of the things that we kind of talk to our clients as when we're looking at medical billing, we want to make sure we adhere to the highest standards of meeting what was required. Typically, there's three things you can look at when you're doing your medical billing. So you don't have to get that dreaded call for an audit by the inspector general. You want to make sure you understand your policies and procedures. You need to understand your billing in and out. If you have a medical biller, it's important to have a third party come in and do an analysis to determine how your medical biller is doing everything that they should. There's nothing wrong with getting a second, third, or even fourth set of eyes on your processes to ensure that you're meeting all the standards. So making sure that you understand that processes and procedures that are going into your medical billing is going to be key. You want to understand exactly how the billing works. You want to have a conversation with medical billing coders. These are the individuals that look at the medical billing from the perspective of the health plan. Having a medical coder come in to just analyze how your medical health plans are looking at how you bill is really important. Right now, you have medical billers who bill on your behalf to submit to the clearinghouse and to the medical health plans, but having a coder that can come in and do consulting would absolutely help you get a better sense of what's possible there. You need to be checking at least quarterly, if not once, twice a year. If you can do quarterly, that's ultimately to kind of bring in these experts to do your medical billing checks as well as bringing a medical coder. But if you can't do it quarterly, once or twice a year is acceptable. And that's really what you want to do just to make sure your policies are in place, making sure your team is creating the right note structure, making sure that you understand there's any abnormal things that will pop up that may come on the radar for OIG. The key there is not so much that you overly check, but the key is you want to be prepared. So in case some statistical anomaly comes up and your name gets pulled, you are ready for the audit and you can answer any questions that they have. So it's really important that you do these checks quarterly, or if you can't do it quarterly, at least twice a year, every 6 months, to ensure that you meet the standards and making sure your people are following these high standards. So one of the things that we kind of help practices think about is number one, you want to think about your succession planning. Do you have a succession plan in place? Around 85% of doctors do not have succession plans in place, especially the independent ones. So what does that mean? If you decide to retire, who do you have in place to take that over? Typically, probably could be a physician colleague or physician group that you've known for years that can handle your patient load. That's great. The great thing is that you know them and you trust them and you know they'll do good with your patients. The bad thing is they may not have a lot of funding or money in order to take over this patient load. And so they may ask you to stay on a little bit longer than you want to, or they may say, hey, we're taking this over, this business. Do you mind if you sell or finance it? Basically being able to provide the wherewithal to help fund the patients as they get over to the new organization, and then making sure that that's taken care of. And then they pay you over time in what they call an earnout, a process by which they slowly pay you your payments so that you can finally be bought out of the practice. That can be great initially, but it takes so long, and it's a lot of ups and downs and hard work to kind of deal with that.
Hey, I hope you enjoyed that. Look, we have more content that can really help you accelerate your practice this year. We have tons of content that can cover all the different topics we discussed earlier. If you want to hear more, click to the right or to the left, and you'll get more content to understand how to best grow your practice.